Hello, my name is Park Ji-hyun. I'm taking this video as an assignment from Professor Nam's Abnormal Psychology. Margaret is a 32 years old who was suffering from mental disorders. She described herself as sensitive and emotional, but hopefully she believed that the CBT would sort her out. Her symptoms were showed up a year ago. One day she was shopping and she began to feel anxious, like nervous and panicky. But fortunately, it went away at first. But 2 weeks later, the same thing happened to her. And it was worse. Her heart beating went fast, and she thought she was going to pass out. After that, she felt afraid to go out, and even sometimes she burst into tears for no reason. When it turned out really bad, she ran out of the shop. And even she felt embarrassed when she just imagined that situation. Since that happened, she was already anxious even before she went out. One day, when she was shopping again, she were in trouble with breathing and nauseous. Also, she felt really embarrassed. She thought that everybody around her looking at her. In the same time, she thought she was so stupid. The worst thing is that she felt kind of pain in her chest, and she thought that was a heart attack. But she could figure out because she read some articles about panic attacks and how people think they are going to die before. She talked herself, this is not a heart attack, and this is a panic. It worked 10 seconds, only 10 seconds. Then she panicked again. So she had no choice but left the shop. But bravely, she came back in after 10 minutes, and she could finish the shopping. She felt proud of herself, and she read a self-help guide on the internet. From the guide, she learned how to get out from the panic, saying like, nobody cares, they're all too busy getting on with their own stuff. But she could use that method only once. When she felt anxious, she usually avoided the thing that gave her anxiety. The fear, anxiety, or avoidance is easily explained by the symptoms of another mental disorder. In my opinion, Margaret was suffering from anxiety disorder and also panic disorder. First, anxiety disorder, which is called social phobia in DSM-4, causes more life disruption than other phobias. And it is persistent and brings intense fear and avoidance of social situations. Also, who had anxiety disorder fear that they will act in a way or show anxiety symptoms that will be negatively evaluated. And after they feel those anxieties, they want to avoid the trigger situations or else endure with intense anxiety. So it has many links between Margaret's symptoms. Her symptoms first started a year ago when she was shopping, and after it occurred intermittently. Ever since it happened, it was hard for her to go out when she felt anxiety. That means she had some problem with having normal life. Also, she thought she was stupid, worrying about negative evaluation from others who were there when she got embarrassed. And she said that she usually avoided the stressful situations. From these things, I can guess that she had a social disorder. Next, panic disorder include labored breathing, fast heart beating, nauseous, chest pain, etc. And it brings person go crazy and lose control. And it attacks with no reason, causing worry about future attacks. It also makes intense urge to flee. And Margaret experienced had same symptoms, like she suddenly burst into tears for no reason and felt heart beating fast. Also chest pain. In the process of therapy, therapists use cognitive techniques and behavioral techniques. For cognitive technique, therapists ask her to keep a thought record for a week, noting when her thoughts were negative. and let her do a positive self-talk whenever she felt anxious. And for behavioral technique, therapist asked her to go to the supermarket where the last occurrence happened each day and focus on breathing, read the self-help guide recommended by the therapist. Thank you very much.